Okay, good afternoon. My name is Dr. Oge Ilebune, and I work at Lakeshore Cancer Center, and I'm your moderator for today's live Instagram session. You're all very welcome. I know different people are keen in from different places. So just a bit about Lakeshore Cancer Center, in case this is the first time you're following us or you've heard about us. Lakeshore Cancer Center is the first operation, diagnosis, treatment, palliation, and advocacy. That's a mouthful, but believe me, we do all that here and even more. In its over 6 years of existence, general health, cancer education, and awareness have strongly defined Lakeshore's contribution to the fight to reduce dismal cancer statistics. Lakeshore has organized 2 physical huge health fairs, one in 2018 right on the island here in Lagos, and in 2019 on the mainland. This has always been in partnership with other like-minded healthcare providers and who have given their time and services to educate and raise awareness. So thank you very much to all our old providers and new providers who have joined us this time. We are very grateful and we're, very honored as well. Now, in 2020, the whole world paused because of COVID-19 infection. And so we had to. No physical mass gathering. People were fearful. All of us were fearful. We're trying to understand the new landscape. And now, as the world becomes, progressively creative and innovative in healthcare delivery, Lakeshore has also gone with the trend. And today, I am very delighted to say that we can present the Lakeshore Virtual Health Fair. So the health fair doesn't have to stop. All we've done is bring it virtually. Now, there are 15 healthcare providers over the next 3 days during this virtual health fair. They are sharing health nuggets to the public, as well as free and hugely discounted services to be redeemed by the end of the month from each facility. So yes, there are giveaways from every facility, giveaways that will be beneficial to all of us. So today, it's my pleasure to welcome Dr. Michelle Neff, whom I know very well, who is representing her facility, Physiotherapy Centers of Africa. And their topic, very interesting, rich topic, is physiotherapy for neurological disorders with emphasis on stroke, Parkinson's disease, and dementia. Another mouthful, and I can't wait for her to really delve into some of these concepts. Let me introduce Dr. Neff briefly before we bring her on, and she can tell us more about her own facility. So Dr. Michelle Neff, PT, DPT, these are her qualifications, is a co-founder and executive director for Physiotherapy Centers of Africa Clinical Excellence Team. She is a doctor of physical therapy and a graduate of Oakland's University School of Health Sciences in Rochester, Michigan, in the United States. She has a BSc in human biology from Michigan State University and over 9 years of professional experience, including training students of physical therapy, monitoring them during their clinical internships. And she has specialized in orthopedics, physiotherapy, and home and elderly care delivery. So mainly dementia, of which she'll be speaking to us about this morning, Alzheimer's, and she also has additional training in pediatrics and acute care. She practiced in Detroit and Chicago before moving to Lagos and has become certified to practice in Nigeria since 2016. I can say that she's an excellent physiotherapist, and I can assure you that today is going to be really, really beneficial to everyone. So very welcome, Michelle, and please join us and tell us a bit about your facility and what you do, and we can start talking around the topic. Thank you. Sorry? Oh, okay. So this is typical of Nigeria. We get used to it. We have, some network issues. So please be patient. Dr. Neff will be joining us. So while, we're waiting, I would like to say a few words about physiotherapy. I think it is a specialty that is undervalued. Undervalued not just by the public, but actually by, health practitioners, by us. There are many conditions that actually should have physiotherapy as one of the key specialists in the management, multidisciplinary management of conditions. I don't think people know enough about physiotherapy. I think it's something that should actually be put in the curriculum during training, both for nurses, doctors, lab scientists, pharmacists, because it's an integral part of what we do. People tend to say, oh, I have a headache, I have a neck pain, and they start taking loads of drugs. But if you've ever been handled by a physiotherapist, and rest assured, I have, by the time they've examined your nerves, your muscles, sometimes you don't even need to take any medication. There are exercises. And the beautiful thing about physiotherapy is that I can assure you, they understand the muscles, the joints, the actions, how they interplay, even more than some of us doctors, because this is what they are trained to do. There's a lot of physics and mathematics in physiotherapy. They are calculating angles. So when you do some exercises, there are some movements that you shouldn't actually do. It's a whole lot of, beautiful, information around physiotherapy. And so today I'm actually encouraging people to speak to their doctors when they have pains, joints, ask, why can this condition not be, why can't I be referred to have a physiotherapy assessment? And then, let's see what your doctor says. Sometimes it's just people sort of haven't thought about it. And I have been, a beneficiary of physiotherapy. I refer patients to physiotherapy, and the feedback is always excellent. However, today, Dr. Michelle Neff's topic is a lot more sort of advanced. It's not your usual mechanical back pain, neck pain, text neck like we do now that we, are using phones all the time. We're using the laptop, sitting all the time. Her talk is around, neurological disorders, Parkinson's, dementia, stroke, very common in our environment as well, because of our issues with, hypertension, diabetes. These are all risk factors for developing a stroke. And usually we find that many people are struggling to actually get care after the acute phase. So the acute phase is that period of time when the stroke has happened or the patient has been diagnosed with dementia or diagnosed with Parkinson's. But these are conditions that are, they become chronic. Chronic meaning that, it's months, years, and we find that families are struggling as well to access care. Oh, doctor, what can we do? They are not eating. They are not walking. They are not doing this. They are depressed. How can we help? So there's a lot of information that Dr. Neff will be giving us today on the management. So we don't have enough rehabilitation centers in Nigeria, but we do have excellent physiotherapists. And oh, there she is. That's one of them. Hello, Michelle.
Hello.
How are you?
I'm good, thanks. How are you?
Okay. All right. Well,
Sorry,
it's lovely to have you here.
We're having a little bit of technical difficulties, but I think we've sorted it out now.
Okay, brilliant, brilliant. Well, I've just been, I'm an advocate for physiotherapy. You know how much I love physiotherapy. So I'll spend the past maybe 5 minutes just talking up a storm. But let me hand over to you. I did a brief introduction of you, your resume and what you do. But, over to you to let us know a bit more about PCA. And then, we can start the discussion.
All right. So thank you for having me, Dr. Oge. Um, so PCA, we're primarily a physiotherapy center, and we pride ourselves in really making sure that we provide international standards of care. So if you really need a specialist in neurology, or you need somebody who's a specialist in, post-operative care because you had a knee replacement, we make sure that we have somebody who's more than qualified to treat any of these conditions. And we like to make sure that we, even have coverage for the less common things. So, women's health conditions, men's health conditions, diabetes management, all of these things that some people are surprised to find out, even balance and vestibular conditions. Some people are surprised to find out physio can do that. And we want to make sure we cover those people who don't necessarily, they have these conditions and have never gotten proper care because they didn't know there were treatments available. So we primarily do that. Additionally, we provide equipment, supplies. So if you need, braces, or we assess homes if people need, things in their house like toilet risers and other things that can sometimes help if you have a disability. We provide nurses and in-home caregivers, and we also train. So, for example, if you have a caregiver that you really like at home, but you're not sure that they're properly trained, we, train them in everything when it comes to recognizing medical red flags and knowing when to call the doctor, lifting a patient that needs help with moving around, that kind of thing. So really patient safety focused. I think that's primarily all of our services.
Okay, that's a lot. And obviously, because you are one of our partners, we already know that, there are a lot more in between, the what you've mentioned, actually. And I know you have different, locations as well. In the past year, during COVID,
Yeah.
while, people were fearful, PCA was courageous enough to actually go ahead during that period to open their Asaba branch, if I'm correct. And that's commendable. And you also have a center on the mainland as well.
Yeah, in Bagada.
You used to have a center in Bagada as well, exactly. Yeah. And of course, your very vibrant center here in Victoria Island as well. All right. Well, thank you very much for that intro. So I was just wondering, the topic you've selected is one that I think is not discussed enough. The physiotherapy for neurological disorders with emphasis on stroke, Parkinson's disease, and dementia. And I found out that sometimes people don't actually realize that there is physiotherapy for these conditions. So, if I'll just have you speak around the topic.
Okay. So I chose this topic because, like you said, I feel like, one, people don't get the proper care for it because they don't necessarily know what that proper care entails. And two, they don't, know what their options are. And the other thing is, even recognizing when, you may have one of these conditions or your family member may have one of these conditions is really important, because getting the correct management quickly is a bit of a big deal. So I just wanted to briefly touch on, I know I see a lot of, in Nigeria anyway, I see a lot of stroke. We also see quite a bit of Parkinson's disease. And then I also chose dementia because dementia is very common here, and people don't seem to realize as well that dementia is not just a disorder of, memory loss and things like that. There's actually quite a few physical conditions that are related as well. So when it comes to stroke, one of the issues we have in Nigeria is that we don't have great data, but we do know that around 150,000 cases of stroke happen every year in Nigeria. And the 30-day mortality, meaning people, who die within a month of a stroke, is as high as 40%. So I think management of that is really important. And the first thing I would mention is just recognizing when you or someone may be having a stroke. So the easiest way to remember, and they teach us this in, like, if you've taken a first aid class or anything, easiest way to remember is be fast. So the B stands for balance, and that's when you notice someone's balance or coordination is suddenly off. E stands for eyes. So when you know that when you notice your vision in one or both eyes is suddenly impaired. F is for face. So you may see like a droop in the one side of the face, or if you ask someone to stick their tongue out or smile, it won't be even. Then A is for arms. So for the arms, if you ask somebody to raise their arms, you might see, I don't know how well you can see on the video, but they'll probably do like this. It's not 100% even. And then S is for speech. Yes. And then S is for speech. So if there's slurred speech, or sometimes I've heard where people are just saying words that don't make sense. I remember when my grandpa was having a stroke, he was just talking about, and he sounded like he was making perfect sense, but if you listen to the word, it was no information coming across. And then the last one is T, and that's time. And that's basically just saying that you have a very limited amount of time to act in order to minimize the amount of damage that stroke will do. The person needs to quickly get to the hospital and get treatment. So recognizing a stroke is first. Then what happens after you have a stroke? So after you have a stroke, it's very important that in the first instance, you're assessed within 24 hours. Usually the physiotherapy assessment happens within the first 24 hours to determine, what impairments there are. And then after 24 hours, between 24 and 48 hours, the patient should actually be, mobilized and start getting up and moving. And these early windows are really important to get the best results in the long run. Then, as you continue with therapy, it's recommended that people have a minimum of 17 hours over a 10-week period, so minimum a couple hours a week. But really, the best results that you can get are with 45 minutes of therapy every single day. What that means is not that you necessarily have to have physiotherapy every single day, but you should be having home exercise programs, things that you're doing at home. And you should be constantly every day working your body and trying to push yourself to get, the best recovery. So generally what happens after a stroke? Usually what we see is on one side of the body, and as physios, we're most often we're dealing with, disabilities that having to do with the arm, with the leg, with balance, with coordination. So a lot of what we do is really just, okay, if there's spasticity, meaning the arm is stuck in this position, we work on how to get the arm functioning, loosened up and moving in a better pattern. If there's weakness, we work on training the specific muscles. And often, a stroke is really a disconnect between the brain and the body. So often what we're doing is we call it neuro re-education. It's brain training, which is why we sometimes do things like virtual reality, and patients will be playing on a Wii and things like that. But it works very well because all these, brain training things are really just reteaching your brain how to do the basic stuff that you already kind of knew how to do before. And, now you sometimes have to relearn. So that's pretty much for stroke. Then the next one I wanted to cover was Parkinson's disease. Parkinson's disease. Another important thing about Parkinson's disease, again, it's not like a stroke where you need to rush somebody to the hospital, but still that early recognition is very important. So, the longer people wait, and one thing I see a lot in this part of the world is that people tend to say, I would never have anything like that, and therefore you let these problems go even though you kind of see them. And sometimes it takes, as a family member or somebody else who's close to them to say, maybe you should get this thing checked out. Even if it's just with Parkinson's, we often see like a slight tremor. You'll see somebody who starts to have that tremor in their hand or their head, see coordination and balance start to go bad. And, things like that. You see their gait changing. So when someone's walking and you start to notice that they're not as confident on their feet, they're taking smaller steps, more cautious steps, or maybe their coordination, like they're taking uneven steps. That kind of thing is sometimes a sign. And one thing we do know from research is that Parkinson's is severely underdiagnosed in Nigeria.
It is.
So, so we don't necessarily have the data, but we know that it's not diagnosed nearly as often as it's occurring. So whether or not, you're sure of what's going on, it's important to just get checked out when you start noticing these signs and symptoms. Now,
so just to interrupt there, so there's a lot of co-management between the physiotherapist and the referrer, whether it's the GP or a specialist. And that sometimes is something, from your experience, would you agree, we actually struggle with here?
Absolutely. And part of it is just that, people sometimes get input from, doctors overseas and doctors here and doctors there, and there's no coordination amongst all the team, and that's really hard, especially with Parkinson's, where you're managing changing levels of medications, and it's really important for the doctor to know, okay, this med is not working so well, it's causing this other problem. Having a good management team is really important. And if the team isn't communicating, it's going to be a problem. So it's very good to be very on top of all your symptoms, on top of everything. Even if, you have this or your parent has this and you notice that their medications are causing problems, it's always good to speak up. Because when you're dealing with the brain, there's all kinds of, small little details that you need to keep aware of.
Yeah.
So, in physio, what we usually deal with, first and foremost, and I'll mention this again with dementia, but first and foremost, fall prevention. Because the people that often have, Parkinson's disease, dementia, all this are our elderly. And falls are a huge, huge risk factor. Once somebody falls, it tends to be kind of a downhill slope if it's not taken care of right away. So as physio, exactly. That's the first thing that we do with elderly patients is to always just, fall risk assessment right away. So it's preventing falls. And then, with Parkinson's patients, yes, it's a progressive disease, but at the same time, in the initial instances, sometimes, progress can be made because maybe they haven't been getting proper treatment before. So there's some progress that can be made. Then once that happens, it's all about management and preventing as much the progression as possible. So you're basically slowing the decline, slowing any functional losses, and making sure the patient stays safe. So if at some point you have to say, look, it's time that we start using a walker, or it's time that we start using this device, these kind of things are managed that way to make sure that no matter what, the patient stays safe. But yeah, most of what we're working on is, having to do with training someone's balance, training their coordination. There's a really cool program called LSVT Big, where their exercises are specifically designed for Parkinson's. So you give them exercises that the patient can also do at home if they can do so safely. And they're working on things that are it's basically big movements, because Parkinson's makes everything slow and small. So big is, doing these big steps, big squats, big arm movements, and coordinating the upper and lower extremities and the left and the right side to really get them back to as good of a walking pattern, even when it comes to sitting and standing out of a chair. But that's the purpose of these big exercises, is to sort of retrain these movements.
So a bit like exaggerated movements, sort of more exaggerated than the usual movements.
Exactly. The more you exaggerate it, it kind of balances it out. So you bring them out of those tiny, tiny movements and bring them into a normal. Yeah, exactly.
Okay. That's fascinating.
So that one, I think with Parkinson's, we've seen quite a bit of success with that. And then I think the only thing I would really just harp on with Parkinson's is I see a lot of patients here who know they have it, and they're like, okay, well, I'm managing with medication, so they don't follow up all the time with their physio. And it's really important to make sure that all of these things, you address them first before it becomes a problem. So it's good to at least, even if it's just that once a month, these things managed, it's really good to make sure that you're following up and, making sure that, things are not the coordinate, because you won't always see it when it happens, when, there's certain balance tests that we do and we're like, a lot of our older patients, if you ask them to stand with their feet somewhat close together and look quickly to the left, just they lose their balance.
The network. Yeah. Gone off a bit again. Can you hear me?
I can hear you.
Okay. It's come back on again.
Oh, okay. So I was saying, with these people, sometimes you'll do a test like that and make them aware of something they didn't even realize. And, what can happen in those instances is if they didn't know and they don't train these balance reactions, someone maybe calls your name from the left and you look quickly to the left and you lose your balance, and that's how you have a fall. So it's just, being aware of these things as they happen and managing it before it becomes anything more pronounced. So the last one I wanted to just touch on briefly is dementia. In Nigeria, again, probably underdiagnosed, but in Nigeria, we know that about 3% of men and up to almost 7% of women over 80 have dementia. And, you know, this one is probably the least common that we see sent to physiotherapy, even though it should be, because people kind of feel like, one, dementia is a issue of memory. It's not really an issue of physical function. And the other thing is, people feel like with dementia, well, the person is elderly, so they're not supposed to be able to move very well, or maybe they're, you know, they're not supposed to be able to do the, yeah, so they just say, oh, well, I'll just help her do this. I'll just help her when she walks. And, you know, that's not necessarily the case. Brain is, you know, losing its function is all managing, you know, body movements. And, you know, the way you don't remember your children's names maybe is the same way you don't remember how the movement you have to do to stand up out of a chair. And all of these things can be trained to a certain extent. And again, with dementia, I mean, because it's elderly patients, sorry, I lost you for a second.
Yeah. There was something you just mentioned that struck me with dementia. Yeah. So we already know that, you know, it's a condition where memory plays a huge part, or the lack of. And just as they forget names, places where they are, time of the day, you mentioned actually they forget the movements as well. You know, not remembering that they have to get up, or you have to hold on to something to balance out, and that's sad, actually.
Yeah, the way that, I mean, we call it movement planning. So the way that your brain says, I want to stand up from a chair, so I have to activate this muscle, and the balance is like this. You know, these are things that you learn, just like learning how to ride a bike. But with dementia, your body forgets. You know, so even simple movements, like I said, like standing up or laying down can be a big issue. And it can be trained. But with dementia, I mean, general exercise and conditioning, balance training, and just managing fall prevention, that's the biggest thing that we really need to do.
Okay, that's really, really insightful, because I just get the sense that, you know, people don't know that physiotherapy is actually a very key element of managing these conditions. And, you know, like you also mentioned, it's not as if these conditions are acute conditions. You know, apart from a stroke, which could obviously happen and it's acute, most of these three conditions become like a chronic, you know, they have a chronic outcome. So people are living with the sequelae of a stroke, or, you know, the Parkinson's or the dementia for months to years, many years. And they, you know, the family, you know, families tend to struggle for those years on how to actually get dad, mom, husband, wife, you know, on movement. And many don't realize that there is actually help out there. I think for me, it's also a case of the health practitioners. How much do we actually know in terms of how we should work with you know, physiotherapists in helping these patients and their families? And I keep saying patients and their families, because rarely do you have anyone who is on their own. You know, you have people having to help, caregivers. So what's been your experience?
I think that's a key point you just made, it having to do with, you know, families and caregivers. So I mentioned we do this caregiver training, and one of the things I've seen is that it's not just, I mean, we expected people to be sending, you know, house help and things like that, because, you know, they're the ones who are there and, you know, managing mama's health all the time and whatnot. But we've actually seen quite a few family members come saying that, look, my mom has this progressive condition, and I know that within the next couple of years, things are going to get even more stressful for me. But really, the mental health and the physical health of caregivers and family members is strongly impacted. So we do see that quite often, where there's a lot of, you know, work we have to do to really support family members and make sure that, I mean, even if it's just that we can advise on certain things, But, you know, we do a lot of advising family members on the right support to have and the right moves to take off as much as possible, because you're right, it's a lot. And then as far as, you know, working with doctors, we find that, you know, whether it's here or overseas, with some things like dementia, for example, we do educate a lot can do, because sometimes it's only when they get to like a specialist facility that someone says, yeah, this person should really have physio. It would help a lot. So yeah, I agree. I think that's really important, is making sure the whole, we say team, but the family and everyone should be a part of that team.
Okay. All right. So I wanted to ask, I mean, you've practiced in Chicago, in Detroit, and, you know, you're here in Lagos, and not just Lagos. I know you've been out of town on, you know, a few occasions as well
Yeah.
as, yes, you have traveled around Nigeria, I must say. And then because you run the training, you know, the caregivers training, you also have many people coming in from, based on your past experience and the current experience, what are our main challenges in the country, you know, with managing this condition, with physiotherapy, you know, being able to be part of management of these conditions? You know, what's our greatest challenge? What's our greatest barrier for, you know, people actually tapping into this resource?
I think it's really just education when it comes to that kind of thing, because, you know, one, I mean, it's educating the doctors, it's educating the communities, it's everybody really, to know, you know, what resources are out there and are available for them. Even, you know, the mental health resources and all that stuff, all these things are really important, but people don't know where, or people don't even think to look for them. And then if you advise, then maybe you could start looking on Google and things like that. But, you know, finding some of these resources is really important. And that's, and like I said, a big part of what we do is actually just, you know, advisory and, you know, guiding people through this process, because, you know, like you said, sometimes for a stroke, with a stroke, for example, it's usually a lifetime management sort of a situation. And, you know, with Parkinson's, it's, you know, progressive, and dementia, it's progressive. So these things are often dealt with for many years. It's not just a brief experience. So I think education is really the key, letting people know what's out there, and that it doesn't have to be so difficult.
Yeah, so education, pretty much what we're doing today, you know, with this
Exactly.
session. Yes, and the government, I mean, from your experience as well, because I know PCA is a very vibrant facility. Let's just take Lagos alone, and I know you engage with a whole lot of, you know, your contacts is quite, your network is quite widespread. But I was wondering, how have you found the government engagement? You know, we have the general hospitals, we have the Ministry of Health. Do you have any ideas in terms of how the government is actually tapping into physiotherapy as a real tool to help improve the conditions of people?
Well, a couple of things I would say I know need improvement. One thing I've seen here is that there's really no emphasis on preventative care. So, and I mean, we see that in everything. There's no, we see it in the insurance companies and all that, the amount they're willing to pay for physiotherapy, which, and to me, I find it funny sometimes, because I'm like, so, for example, if you were to send somebody for an MRI, you'll pay like 15 times what you're going to pay from sending them to physio, but you would have gotten that information from a physio much. And the research actually shows physio is the correct route to go first before an MRI. So international standards would dictate, but, you know, they're doing the other thing. So it's definitely, preventative care is just not focused on in any way, shape, or form. And so, I mean, that's one. And then the other thing I think is also disability access. We really need to improve our services for the disabled. You know, we try and do things when we have, for example, if we have a patient who, you know, we know this person really needs services. We have sometimes programs where one patient will have extra visits and donate it to another patient that they know is in need. So we'll distribute those sessions to people. And, I'll give you one example in particular. We have someone who got like 30 sessions donated for him, but he hasn't been able to find like a transport or a way to get here. And so that's our next project, is to figure out how we're going to know, and
transport. Yeah.
And to me, it's like all these things, there should be a way. Everything just seems to make things difficult for people with disabilities. So I think, improved like access to the communities and things like that would really be helpful.
Right. In fact, you just mentioned donation, and my mind went straight to foundation, NGOs. Are there any, so for instance, within the cancer space, we know we have some cancer NGOs and foundations that help indigent and, just people who are vulnerable and unable to either provide care for themselves or pay for care. Do you have any within the physiotherapy space? Are there foundations working, advocacy groups that are generally trying to work with establishments as yours and other facilities?
Yeah, I think so. I guess I don't know of too many that are, physio specific, but for example, I know there's, organizations for cerebral palsy, and there's organizations for amputees. There's one foundation I know that helps get prosthetics and orthotics and things like that. So yeah, there are. And if anybody knows of any, I would love contacts, because the more contacts, the better. But yeah, I mean, I do know of a few.
Yes. Okay. I think that also brings me to a question I've always wanted to ask. With doctors or even family physicians, sometimes you decide to focus on one area. So you become a specialist in just the, maybe hypertension, or you decide you want to focus on diabetes. So with these conditions you've actually mentioned, the Parkinson's, the dementia, the stroke, can every physiotherapist actually manage those conditions? Or, is it one of those that is sort of super specialized, and the physiotherapist who manages it is not a generalist?
I would say most physios at least have the basic tools, but one thing I would advise patients is, one, if you can get a specialist, do, because there's always going to be people who's, whether or not they've even done like an official thing, but if they've always particular issue, then they'll be better equipped to handle it. And two, the other thing I always tell people is, hold your doctors, hold your physios, hold your healthcare practitioners accountable for the services that they're providing to you. So we see patients sometimes who come to us after having done hundreds of sessions, and they're like, well, but I kept going, but I never made any progress. And I'm like, well, did they change your program? Did they? No. So, understand that you should be going to someone who's constantly looking for new things to try, constantly looking for progress, constantly reassessing you. And if your therapist isn't doing that, then it's probably not the right therapist, to be honest.
Right. Okay, that's great. Another question. What are the myths and misconceptions? Every medical health condition has a myth or some myths around it. What have you found to be myths and misconceptions around the management of these conditions?
Well, I think one of the biggest ones in Nigeria that I've seen is that with neurological things, we tend to get a lot of that it's something spiritual. So yes, we get that a lot. And, when that happens, people tend to try and go other routes first. And I keep mentioning that, one of the really important factors is timing and getting the right treatment fast. So sometimes it takes a while before people actually come around to physio because of that myth that, the first port of call should be, to address the spiritual issue first before you address the physical issue.
Yes, without sounding funny, we are a deeply spiritual society. And, that seems to permeate everything, even when it doesn't make any sense, any logical sense. And like you said, then they come back and timing is everything. Sometimes it's already almost late. I think we have the same situation, in cancer care. Alternative therapies, and then patient comes back and you're just so sad because a lot more could have been done. So I think this is information for everyone to be mindful of. And there's nothing that stops you from accessing care, going on with your care while you're still, delving into your spiritual, whether it's your pastor or, your imam to help pray for you. I think both can
Absolutely.
go hand in, they can go together. So,
Yeah. There's
do we
a
have,
lot to be said.
yeah.
I think that there's a lot to be said for the, for the power of prayer and positive thinking and all these things. But I agree, it has to be, it has to be hand in hand. And the only other thing I would have mentioned as far as myths is that with a lot of these neurological things, like I said, people tend to feel like it's just a natural, it's just something that happens naturally as you get old. And therefore it's not meant to be, nothing is really meant to be done about it.
Yeah. And of course, that also comes down to their perception about paying for service. So if these are families that maybe they don't have health insurance and they're going to pay out of pocket, if they already have a perception that, why are we forcing? What's about, physiotherapy? What is it going to do for this patient? We would rather not pay money for physio. Let's channel the money in the, getting more drugs, more medication to help the patient. And yet, in a lot of these conditions you've described, the physiotherapy will actually reduce the need for them to have to get certain drugs. If you're sitting around, you get stiff, you get pain. But if you're moving and active, then of course, you have less pain, you have less contractures and, stiffness as well. So there's a lot of work to be done, I think. There's a lot of work to be done.
Yeah.
Yes. So, well, I don't know how many more minutes do we have? Right. So we have 3 more minutes. Michelle, I don't know. Do you have some last minute sort of take home for those who have joined us today on this?
I mean, I think the main take home of this discussion is really just, if you feel like something is not right, get it checked out. And make sure you get treatment early when you notice something isn't, if you're noticing your family members behaving differently or moving differently and all that, just advise people to, get help as early as possible so that these things don't go on for so long.
Okay, that sounds good to me. And I'll just add my voice there to say, please, if you're listening, spread the word. If you have patients, if you have friends, family, where there's dementia in the, they have a family member with dementia, Parkinson's disease or stroke, physiotherapy is an integral part of that management. Please don't let anyone convince you otherwise. There is, no situation in any of those 3 that physiotherapy cannot come in. It's almost the mainstay. I mean, in some countries, I don't think we have many of it here. We actually have a huge neuro rehabilitation centers. And I think more or less the physiotherapists are actually running a lot of these rehab centers as well. They are an integral part of the system. Have we got any rehabilitation center in Lagos?
There's a couple inpatient rehab. We don't have like a proper rehab hospital. So the physiotherapy centers have started doing that, and we actually will be opening one probably next month in our mainland center, and then we're probably going to do a couple beds in our VI center as well. But I mean, it's not. I would love to see eventually. Maybe I would love to be involved in it. A proper rehab hospital, because I think that would be fantastic. And there's so many. I mean, there's speech therapy involved in that, occupational therapy, physiotherapy, recreational therapy. A well-done one will really have all of the specialties integrated together and really just have a complete rehab team.
Yeah. That's fantastic. So I would love to, thank you, Dr. Michelle Neff, for being here with us. I would like to thank PCA, Physiotherapy Centers of Africa, for what you've been doing. I mean, you've done so much in is it 2 years, 3 years since you started? You've been very active, you have advocacy, and you are helping a lot of people out there. I think Lakeshore can attest to that. And for this, this virtual fair, we want to thank you for your contribution as well. So for everyone out there, PCA is giving us a couple of discounted initial consultations from now till the end of May 2021. So please reach out to PCA and just say LCC giveaway. So that shows that you have the code, and they can, tell you what the discount, how to access your discount, and, go from there. I can assure you, you're going to learn more beyond just that consultation. They have a lot going on there. And so please join us at 3 p.m. for yet another virtual fair session. This time, the session is Dennis Ashley Medical Clinic, and the topic is obesity, epidemic, and the risk. So I will certainly be listening on very attentively. I think most of us are overweight. And it will be interesting to, hear from Dr. Mamsala Omishere what her views are on this. So see you at 3 p.m., everyone. Get yourself a drink, coffee, tea, and settle down for the next session. Thank you very much. And thank you, Michelle. Have a good day.
Thanks for listening. Thanks for having me.
Okay.